Greetings. It is very important for you to do urinalysis during pregnancy. In fact, I even recommend that every pregnant woman that go for antenatal should do urinalysis for every antenatal visit. Why? With that urinalysis, you'll be able to detect certain diseases or diagnose certain diseases like diabetes, hypertension in pregnancy. When you have diabetes, right, and you are pregnant, when you do urinalysis, it will show the presence of high level of glucose in the urine, right? Though you may have 1 plus, even though you are not diabetic, but when you now start seeing 2 pluses, 3 pluses, yes, of glucose in your urine, is a pointer to diabetes, right? And if it's peaked on time, something can be done about it. But when you notice that you are overweight and you are pregnant, the likelihood of you having diabetes is high. So that's why you must be doing that urinalysis. Then, preeclampsia, hypertension in pregnancy, you can actually diagnose hypertension in pregnancy just by doing urinalysis. A woman with elevated blood pressure with protein in her urine is preeclampsia, hypertension in pregnancy, until proven otherwise. You get. So if you do urinalysis and they tell you that there is some pluses of protein in your urine, it's pointing to the fact that you will now check your blood pressure is high. That is preeclampsia. And you know the dangers of preeclampsia. So please make sure you do urinalysis during pregnancy. Then, urinary tract infection can be detected from urinalysis. Urinary tract infection can be detected from urinalysis. If there is nitrite in your urine, it's a pointer to the fact that you have nitrite in your urine, and you notice that when you are urinating, you feel pain and you are having fever. That's urinary tract infection. And once you detect it, your doctor will give you the right medications to treat it. So you can see the importance of that urinalysis. It's a cheap test, bedside test, but it can save you a lot of heartaches. It can solve a lot of problems. All these things I just mentioned can cause miscarriage. All these diseases I mentioned can cause miscarriage in pregnancy. Can even cause birth defect. Diabetes, preeclampsia can cause urinary tract infection can cause a miscarriage. So don't joke with urinalysis during pregnancy. Thank you and bye-bye.